Welcome, everybody. I know people are just signing on right now, so we are going to give it a minute or two before we get started. I'd like to welcome you all to our workshop tonight. We will be hearing all kinds of great information from NIH about the different kinds of research projects they are doing, which affect you. I see we have a couple board members on the call, so I'd like to thank our board members Heidi DePaula and Kate Kennedy for being here with us tonight. So tonight, again, our seminar will be on connecting families to research which affect you, and we have three esteemed NIH staff here with us tonight. We have Melissa Parisi, who's an MD and a PhD. We have Sujata Berdahan, who's a PhD, and I see I made a mistake on the slide. And we have Linda Garcia, who works in the communication department. So for those of you who are unfamiliar with the Down Syndrome Network, our mission is to empower and support individuals with Down syndrome, their families, and the community through education, information, public awareness, and advocacy. I'll just go through a few little housekeeping items while people are still signing on. As you all know, since you did sign on, the presentation is being recorded. We ask that everybody stay on mute during the presentation. We welcome people to leave their cameras on so that we can see participants. Please use the chat feature or raise your hand using the reaction tab to ask questions. For closed captions, click on live transcript and then show subtitles. Please keep your questions general. And then we do have a presentation evaluation that I will put in the chat box towards the end of the evening. And we request that everybody fill that out at the end of the night. So our speakers tonight are Melissa Parisi, MD, and she is the Chief and Intellectual Developmental Disabilities Branch at the Eunice Kennedy Shriver National Institute of Health, Child Health and Human Development at NIH. We have Dr. Sujata Berdahan, who works with the DS Connect project. She is a health science administrator. She works with the DS Connect registry, again with the Intellectual and Developmental Disabilities Branch of the Eunice Kennedy Shriver National Institute of Health, Child and Human Development section of NIH. And then we have Linda Garcia, who does outreach for both programs. She's the Communication and Outreach Coordinator for the Include Project and DS Connect for the Down Syndrome Registry. She works for the Intellectual and Developmental Disabilities Branch of the Eunice Kennedy Shriver National Institute of Child Health and Human Development at NIH. So I'm going to stop sharing my screen and I am going to turn the presentation over to our esteemed speakers that have joined us from NIH.
Thank you for the warm introduction. And do I need to change my settings here?
Yes.
Okay. How's that?
Good.
Can you all see that? Okay, great. Thank you so much, Joy, for welcoming us and for inviting us to join you all. And as you heard from our rather lengthy institute affiliation, we have the NIH Institute name that is the longest of any of the 27 institutes at NIH, but we are named after Eunice Kennedy Shriver, and we're very proud of that fact because she was a very strong advocate for people with disabilities, and we're pleased and proud to carry on that important legacy. And I wish that we could be with you all in person because it's always nice to be able to see people's faces and see reactions, but you know, we do the best under these conditions, and you know, we're just pleased that we'll be able to have this conversation with you all while we're telling you a little bit about research that may be important and impact you. And Linda, I'm noticing that the title is different from the final title that we agreed on. Do I have the right version of the slides?
Yes, it probably downloaded from Teams that we just downloaded a few seconds ago.
Okay. All right. Well, we'll carry on.
Yeah.
All right. Thank you. And you've already heard who we are and what we do, and we're all three from the National Institutes of Health. So tonight we're going to tell you a little bit about NIH, the National Institutes of Health. Then we'll tell you about the INCLUDE project, including what that stands for. And then Dr. Barden will talk about DS Connect, the Down Syndrome Registry, and give you some important information about updates on this resource. And then finally, Linda will tell you about our community engagement and outreach activities related to both DS Connect and the INCLUDE project. And we hope that we'll have a chance to answer any of the questions you may have after our presentation. So the National Institutes of Health, and again, this is where I wish I could have audience participation, but I'm wondering how many of you have heard of NIH. If you realize that it's basically in our backyard, it's actually housed within Montgomery County. So the NIH is the nation's medical research agency. It's based here in Bethesda. This is a photograph, an aerial view of the NIH Clinical Center, which is the largest research hospital in the world. The NIH is the world's largest funder of biomedical research, and it's actually made up of 27 separate institutes and centers, each of which has a slightly different focus and emphasis. Since January of this year, Dr. Lawrence Tabak is our current acting director, as Dr. Francis Collins, you may have heard about him. He was our director for, I think, about 12 years and recently stepped down, but he's still active in the research community and is working as a special science advisor to President Biden. The NIH is really a key funder of biomedical research. It has an annual budget of over $40 billion with a B, $million per year, and 90% of those funds actually go to universities throughout the country that fund research based on reviewing grant applications that are submitted by investigators nationwide. So this is a very important institution that is really engaged in trying to fund research related to a whole host of different medical conditions. And, you know, this is an introductory slide about Down syndrome, but I know you all know this, but what I really wanted to emphasize is that Down syndrome has a lot of co-occurring conditions. And not everything is found in everybody with Down syndrome, but these occur in enough individuals that they're important for us to note and also important for us to consider when we try to think about improving quality of life for individuals with Down syndrome. So intellectual disability is a common finding. There's an increased risk of Alzheimer's disease in adults with Down syndrome. Conditions such as sleep apnea and hearing loss are more common in Down syndrome. There are also quite a few autoimmune or immune disorders that you've probably heard of, including celiac disease, hypothyroidism, and diabetes, and congenital heart defects, which are found in 50% of babies born with Down syndrome. And in fact, one of the reasons why research in Down syndrome is so important is that it has contributed significantly to the increase in lifespan for individuals with Down syndrome. Believe it or not, back in 1959, the life expectancy of a newborn with Down syndrome was only 9 years. And then you can see over the past several decades and up through 2007, the life expectancy was 50 years, and it's even higher than that today. And, you know, this dramatic increase is based in part on some of the strategies and medical advances that were made, particularly to help with babies born with the congenital heart disease and being able to repair some of their heart defects and treat them effectively so that they could have a longer lifespan and an improved quality of life. So with that introduction to NIH, I wanted to move and tell you about the INCLUDE project. And first of all, just tell you a little bit about some of the goals of the project. This was actually launched in 2018 under a congressional directive to address critical health and quality of life needs for those with Down syndrome. It is investigating conditions that affect people with Down syndrome, those co-occurring conditions I was just describing to you. It also is what we call a trans NIH initiative, which means it involves more than just one of those 27 institutes. In fact, it involves about 18 of the different institutes at NIH. And we hope that it will be transformative for people with Down syndrome. We hope that it will continue to increase the number of investigators that are studying Down syndrome, and really importantly, engage with families and individuals with Down syndrome to really help advance the research. So you may be wondering, okay, INCLUDE. I know those people at NIH, they really like to use abbreviations and acronyms. So what does INCLUDE mean? Well, it stands for Investigation of Co-occurring Conditions Across the Lifespan to Understand Down Syndrome. And if you put those capitalized letters together, you get INCLUDE. And really importantly, there are three main components to INCLUDE. And without going into excruciating detail about each of these components, it's important to note that the first component is really very basic science focused. So what we mean by basic science is trying to understand some fundamental mechanisms, maybe look at cell or animal models related to Down syndrome, and try to understand why an extra copy of chromosome 21 causes some of the conditions related to Down syndrome. The second component is here in the salmon color, and this is really to build a large cohort of individuals or a group of individuals with Down syndrome for comprehensive analysis and to look at biomarkers. And what we hope this will do is help us understand a little bit more about Down syndrome across the lifespan so that we can understand what are some of those risk and resilience factors that contribute to some of those co-occurring conditions. And then finally, and very importantly, in lime green here, we have component 3, which is really to include individuals with Down syndrome in existing and future clinical trials. And the reason why this is so important is that in many cases in the past, when there have been clinical trials for conditions that are common in Down syndrome, people with Down syndrome have been excluded because there's this assumption that it may be too hard to have them provide informed consent, or enrolling them in the research may be more challenging. But we really want to turn that on its head because we don't think it's fair to people with Down syndrome to not be given an opportunity to participate if they're interested in being a part of clinical trials. So that's really one of our third goals related to the INCLUDE project. This is the money slide, literally, and this is really the slide that tells you a little bit about the funding for INCLUDE and what it has done to help really jumpstart in a dramatic way the amount of research funding for Down syndrome across NIH. So back in 2008, the total investment in Down syndrome research was only about $17 million for that fiscal year. And you can see that it was basically around $20 million for quite a while until sort of 2016, 2017, the total funding for Down syndrome research started going up. In 2018, we added an additional $23 million for INCLUDE funding on top of our baseline funding for Down syndrome research. And that allowed us to fund $60 million worth of research in 2018. And you can see with subsequent investments in Down syndrome research, with $65 million invested just last year, we're up over 100 to about 110 or so million dollars each year. So this past year, we've been able to fund a total of 53 new awards just in Down syndrome alone through the INCLUDE project, and $65 million worth of funding. And my dog just came by to say hello, so I apologize if you see a big yellow lab nose saying hello to everybody today. So you might be asking, all right, well, that's a lot of money. So what have you done so far with that money? And so I wanted to give you just a brief snippet of some of the studies that we have been able to fund using INCLUDE funding. And keep in mind that even though some of these have just recently been funded over the past couple years, usually it takes a couple of years before there are enough results that may actually be published and available and translated into actual differences in clinical care. So we have to be a little bit patient about what some of these research projects are teaching us, but we think that they're important nonetheless. So a couple of projects have really been looking at the impact of COVID-19 infection on individuals with Down syndrome, and even just the pandemic in general on how it's impacted the mental health of people with Down syndrome and their caregivers. There's another study that's looking at acute lymphoblastic leukemia in children with Down syndrome. As some of you may know, this is a more common condition in Down syndrome than in children without Down syndrome. There's a group that's looking at trying to validate cognitive measures using something called the NIH Toolbox, for children with Down syndrome. And the importance of having these types of measures is that they allow us to compare the impact of interventions and clinical trials that we hope will help improve some of the cognitive parameters that we're trying to study. There's some studies that are looking at language acquisition and articulation, speech articulation in children with Down syndrome. A study that has been very popular with a lot of families and parents has been a study to look at whether a home-based sleep study could be as reliable and accurate to diagnose sleep apnea as a hospital-based sleep study. And for those of you who've had to take your young children to the hospital for sleep studies, I think you know what I'm talking about in terms of how challenging it can be to feel like the data are reliable and just even to get your child to fall asleep in a sterile setting like a hospital setting. There's a recent study that's looking at the effects of hypoglossal nerve stimulation, which is used as a treatment for sleep apnea, and whether this can actually improve language and cognition for the children and young adults who have received this treatment so far. Another study is looking at ways in which the eyeglass prescriptions for children and adults with Down syndrome can be optimized to make sure that the visual correction is ideal. And then finally, there's a study, several studies that are actually looking at biomarkers of neurodegeneration and what kind of factors may increase or decrease the risk of developing Alzheimer's disease in adults with Down syndrome. So these are just a sampling of some of the studies that have been performed. Now, I wanted to mention something about why it's so important to have people participating in Include and by extension in DS Connect, which you'll hear about in just a moment. And this really goes to the importance of a sample size. So if you have a population of individuals and, you know, for the sake of comparison, we could say, well, this could be a population of people with Down syndrome. And if you just have a small sample of 5 of the individuals among this larger population, you might conclude that there are no green people here, or green men or green individuals with Down syndrome, because the sample has not representatively included individuals who are colored green in this particular case. So the advantage of having a large sample size, we can make more discoveries and we can be more inclusive about the discoveries that we make so that we don't make erroneous conclusions about an impact because we don't have a large enough sample size. So that leads me to the second component of Include, which is the building of a large cohort. The Include Data Coordinating Center is really focused on that second circle of Include, which is really trying to create a large longitudinal population of people with Down syndrome who've participated in research or who are going to participate in research so that we can understand Down syndrome better. The DCC was launched in fall of 2020, and the website went public on October 1st of this past year. If you're interested, you can go to the website yourself. Currently, there are 2,600 whole genome sequencing studies available from people with Down syndrome. That's the largest collection of genomic information available from a large population of people with Down syndrome. And it's focused right now on trying to understand heart disease and leukemia, but we intend and plan for this to be even larger and more expansive, because we know that just because you have an extra copy of chromosome 21 doesn't mean you're going to develop heart disease. In fact, all the other genes and environmental influences on other chromosomes actually are important for understanding some of these co-occurring conditions. So that's why we're trying to build this large cohort and really trying to reflect the population at large. This also reflects listening tours with many Down syndrome related groups. And in fact, the DCC has really tried to facilitate data sharing among projects, researchers, and participants. They just recently launched their data hub, and stay tuned for more information, more data to be included within that resource in the coming months and years. So the Data Coordinating Center is really trying to help researchers work together using the newest technologies, using really cutting edge data sharing policies and procedures, and really making sure that the data are most available. And there are 3 components. We like the number 3 in Include and in Down syndrome. And Joaquin Espinoza, you may have heard of him as a well-known researcher at the University of Colorado. He's leading the administrative and outreach core of the Include Data Coordinating Center. Laura Mangravid is leading the data management core from Sage Bionetworks, and Adam Resnick at Children's Hospital of Philadelphia is leading the data portal core. So these are all key components of the data coordinating center that are going to really transform Down syndrome research in the years to come. So before I close, I just wanted to mention a couple of the guiding principles for Include. We really think that this initiative is designed to, first of all, respect the rights of people with Down syndrome, use inclusive people first language. We don't refer to Down syndrome patients because that's just not really appropriate. These are individuals with Down syndrome who may have some other conditions that we want to try to help with regard to improving quality of life. We agree and adhere to data sharing broadly because that's the only way advances can be made. We don't want individual investigators to keep all their data and resources to themselves because that's not really the way to advance the science more comprehensively. We also want to increase the diversity of researchers and research participants, and you'll hear a little bit more about that from the other speakers. We believe that outreach to families is essential to the success of the Include project. And to that end, we've been partnering with advocacy groups. And in fact, one of the groups that has been really instrumental in helping to support a lot of our Down syndrome related activities is the Down Syndrome Consortium. On the left is a list of many of the Down syndrome related institutes at NIH that are part of the consortium. But even more importantly are the self-advocates that are part of the consortium and the 16 different groups, foundations, and Down syndrome related national organizations that really have an interest and a commitment to supporting Down syndrome research. And the Down Syndrome Consortium has been instrumental in the creation of DS Connect, the Down Syndrome Registry, which you're about to hear from my colleague, Dr. Barden.
Thank you, Melissa. Can you all hear me?
Yes.
Good evening, and we are so pleased to be able to come to you virtually and present. And pre-COVID, I think we had probably presented once for DSNMC in 2014, and that was in person, and the world really looked different. So really happy to be here, even if we are not face to face. So as Melissa said that, the DS Consortium has been instrumental in their support of the activities that we do at NIH to support Down syndrome and research related to Down syndrome. And really, it's almost a decade ago that, they came to NIH, and we usually meet 3 times a year, once in person and 2 times over the telephone. And really, one of the tasks early on was to create this online registry to be a resource for the community. So it's going to be 10 years next year that the registry was launched. So we are in our 9th year. Next slide, please. So the registry is really an online tool where there are surveys and questionnaires to really collect the basic health information and a very basic demographic of an individual with Down syndrome. It's all family entered. And as you can see, we have somewhere over 5,400 participants, and we have all the website materials translated in Spanish as well. We do have international participants as well on the registry. This is also available on a responsive web template, so can be accessed through an iPad and phone. And this was really one of the feedback from a dad at a conference saying, we really want this website to be available on our handheld device. So, we are constantly trying to improve this resource for the families. Next slide, please. So security is very critical for us for this registry. Of course, we are collecting information on participants. So we have really tried to make it so that we're not collecting information that we don't require. So we're not collecting social security information and bank information, addresses, and really the bulk of our work goes into maintaining the security of this website. There are over 250 security controls that are checked regularly. It is a FISMA moderate level. There's encryption for any information that's in there. The password is really the hard part of this registry because you have to come up with a really complicated one, and then you have to change it every 10 months. We were able to get a waiver for 10 months. For us at NIH, we have to do all of this and change it every 3 months. So now the directive for password is really to have a phrase. And we tell families to have some sort of number that, it's hard to come up with new passwords all the time. So really have a number, and you can change the number regularly when you have to update it. Next slide, please. So as I said, the registry is really built to be modular, and the consent process and the account creation process takes about 10 minutes. And then every participant is able to view the initial health questionnaire, which has trigger questions embedded in it. So there are 50 questions, and about 10 questions are trigger questions. So if you indicated that your loved one with Down syndrome had a congenital heart defect, then you see additional 5 to 7 questions related to heart. So not everybody sees all of the questions within the registry. And we're constantly trying to add and improve this resource. And literally this month, we were able to launch a sibling survey, where researchers who are looking for sibling controls will be able to come to DS Connect and try to recruit families that have siblings of a loved one with Down syndrome. Next slide, please. So all of the questions within the registry and the answers are available for families to view as aggregate de-identified information. So no identifying information is visible from these responses. And basically, a family member can hover over these pie charts and bar graph and see how many people responded and what are the responses. This is also similar to a professional who has an account on DS Connect. They are able to see this similar view as a family member. Next slide, please. So again, we have built the registry to be a resource for the families. And what we have heard from families is that they really value this healthcare provider listing. This is family entered data. So we at NIH are not rating these providers, but we are hoping that families who love their providers are adding their names, and others can sort using specialty. And if they're moving to a new city, they can use those search functions. And this is a constantly growing resource. So currently we have more than 800 providers listed on this resource. Next slide, please. Again, we have a very active Down syndrome consortium. So anytime any consortium member has any useful resources, we try to link to those from DS Connect. So American Academy of Pediatrics has these healthcare checklists. Depending on the age of the child, they are available on the dashboard. So here's a snip of how it looks. So not everybody sees all of the healthcare required recommendations, and only sees what is relevant to them. We have also listed NDSS, their guidebook, and their guidebook for caregivers for Alzheimer's and Down syndrome. And we are also going to link to Global Down Syndrome Foundation's recent publication of adult healthcare guidelines, which will be again available from our website. And if someone has a loved one with Down syndrome, age 21 and older, it will be visible on their dashboard. Next slide, please. So again, a resource, NIH does list a lot of clinical trials happening in different conditions and disorders. But what we have done on DS Connect is made it simpler so that families can just view clinical trials or studies related to Down syndrome, which are NIH funded. And if families want to know more, they can go directly to the website with the link So again, trying to build the registry as a resource for the families. Next slide, please. So this is just a map. This is a heat map, so no one can drill down to exact address and see a few cars parked on the driveway. That's not what this map is. But this is real time. So anytime people register, this map is updated. And it also gives us a way to know where we need to outreach more. You see there are a lot of places we definitely have to fill. I've just pulled up the data from our DMV area and also Pennsylvania. So we have a lot of work to do. It's really, the last 2 years we haven't been able to travel, but thankfully there have been virtual conferences, and really it is up to the DS community now to really outreach for the registry. And I'll just mention why that is so. Next slide, please. So one of the reason is also, as Melissa said, that we have to really try and include everybody in the research that we are funding. And if you just look at the race ethnicity data, we definitely need to do a lot for including underrepresented groups in the registry. Next slide, please. And that really is what she also mentioned, is really when we are looking into aggregating all of these data from all the studies, looking at whether there is any correlation with race ethnicity for the coexisting conditions with Down syndrome. We really cannot be looking at the myth of not having green men. We have to be inclusive so that we get a clear snapshot of Down syndrome in all ages and also in all race and ethnicity. So really our mantra here when we are coming up with our 10th year anniversary is to make sure that we are able to outreach and include as many individuals that we can. Next slide, please. And so, with the increased funding for Down syndrome from Congress, we are very pleased to have bipartisan support for Down syndrome, and that trajectory of the graph going up is really, amazing. But what that is doing is, we're funding a lot of researchers. You see 532 researchers have already registered on DS Connect. A lot of activity in this last 2 years. Of the studies in last 8 years, we have been able to provide recruitment support to 89 studies, of which 15 came just in this last 1.5 years. So we have been, really helping the research community to recruit for their studies. There is a research review committee that approves and reviews all of the access requests that comes in. And again, access request is not that researchers get a list of emails. It is really us as registry coordinator that we let the families know that there are research studies that they can choose to participate or not. So the contacting of the study team is really done by the families. We just let the families aware of all the research studies if they are eligible. So really, this is what the DS Connect registry has been able to do in this past 9 years. And so it is really critical to, even if, families choose not to participate, at least still be part of the registry, because now this is the main way that we are recruiting for these include funded research studies. And so it's really critical to help, the researchers that we have been able to fund to show Congress that, the money that they have allocated for Down syndrome is being used well, and researchers are able to recruit for their studies, and then hopefully we will have good results from that. Next slide, please. So all of the research studies that we support are again listed on the website and under resources now recruiting. And as you can see, there are different studies that we have been supporting. And the very cool thing is now that these are also there are many include funded researchers who are now coming to DS Connect to recruit. Next slide, please. And again, as I said, and one more click, Melissa, is that really it's the family's choice how they would want to participate or even not participate. Even if you're part of the registry but choose not to participate in any studies, that is still good, because we can, see where the gaps are and really look at the data for the DS community. So I think that's the next last slide for me, and I will hand it over to Ms. Linda Garcia to talk about community engagement and outreach. Thank you.
Thank you, Sujata. Hi, everyone. Thank you for being here tonight. I am grateful to the Down Syndrome Network of Montgomery County, Joy, and the board members for inviting us to participate. I saw some families, Spanish-speaking families that joined. Buenas tardes, familias. Bienvenidos y espero escuchar de ustedes si tienen cualquier duda en el futuro. Echoing what Melissa said, I'm going to speak about community engagement and outreach. It's so important for families. It's essential for the success of our research initiatives to have a presence in the community and for the families to really understand the importance of Down syndrome research. Community engagement is our priority for our team, and we participate in numerous events in the Down syndrome community. Next slide, please. One of the most recent events that we participated on, this is one of our Down syndrome consortium members, NDSS, and we were not able to travel. So Dr. Anna Espensen represented us at the Adult Summit it was sponsored by the Down Syndrome Association of Jacksonville, and she did a wonderful job. She presented in person, and it was a great success. Families really enjoyed her presentation about DS Connect. Next slide, please. Oh, I'm sorry. Here's missing my photo from the video. I'm sorry. No, that's the right one. Yeah. That we presented a session in Down Syndrome International's World Down Syndrome Day Conference at the United Nations. We are extremely proud of our participation. We created a video, which we're going to show you later on at the end. We're just afraid that our screen might freeze, so we're going to show it to you at the end of our presentation before we do questions and answers. But I think you're going to really enjoy it, and we're extremely proud to be part of that event, which had, I think our video was projected to almost 20 countries around the world. So we're extremely proud. Next slide, please. We just participated this past weekend in the Massachusetts Down Syndrome Congress Conference. It's a 38th annual conference that they organized. We spoke about diversity and inclusion in Down syndrome research, and they had a great attendance. Over 400 families registered, and they had 32 states, 7 countries, and 31 live workshops. And it was just incredible to be part of that conference. We hope that a lot of families really learned a lot from our conference and will be encouraged to be a part of DS Connect. Next slide, please. This summer, we're going to be at the NDSC convention. I can imagine that many of you are going to be part of that event. We look forward to seeing you there. We're going to be presenting a 90-minute session at the conference. We're also going to be participating in the exhibitor floor, which we're going to have laptops. We're going to have all our equipment there. It's going to be a kiosk for you to actually register and be part of the DS Connect. If you have not joined, we're going to help you. We'll explain the steps to join the registry, and we look forward to just meeting you in person. We're just so excited to be at an in-person event. Also, the Down Syndrome Consortium will be meeting at the NDSC convention this summer. So it's just going to be a wonderful family reunion, and we look forward to seeing you there. Next slide, please. We also make it very easy for you to share resources about DS Connect. If you have not joined the registry, this could be a great way for you to understand a little more about it. We have flyers in English and Spanish. We also have a link that I can share in a little bit in a chat room, in the chat. And you're going to be able to even load messages into your social media pages. It could be in Facebook, Twitter, Instagram, even on TikTok. Just help us, please help us spread the word about DS Connect and the importance of Down syndrome research. We make it very easy for you. We have a full kit and it's downloadable. And we even have messages in there that you can just copy and paste on your social media. So we'll be very grateful. If you need any help, you can always send us an email and we'll be glad to provide more information to you. Next slide, please. And we want to encourage families to sign up to help us reach a goal of 10,000 registrants. We want to reach this goal, hopefully, maybe by the end of this year. If all of you help us spread the word, we might do it by the end of this year. But if not, we really hope our 10th anniversary, which will be next year in September 2023, we want to reach that goal of 10,000 registrants. I think if the whole community works together, we can really accomplish this goal. And you can find the link to our site. I think Joy is going to share our slides. So make sure you visit our page and just explore and see how easy it is. If you have an adult with Down syndrome, you can just guide them. They can do it on themselves if they're adults. If they're over 18 years old, they can do it on their own and allow them to become part of DS Connect. Next slide, please. Thank you. And then now, Melissa, let's see if we can play the video for Down Syndrome International World Down Syndrome Day.
Okay. Hang on just a minute. I'm going to stop sharing for a moment so that I can find where I downloaded the video, because I have it.
I think it's also in the notes. Mm-hmm.
Okay, and now I'm pulling this up. And then my understanding is that if I share my screen, share sound, aha, there's a little checkbox there. We're going to try this. Okay. All right, so this is know. Can you all hear anything? I don't.
No.
Let's see.
Oh, here. Let me start it all over again. I think I had the volume too low.
Got it. Got it.
Inclusion, what do you mean? Oh, what do you mean?
Which one are you going for?
I'm going for, is me. I have DS and want to join DS Connect. I'm 18 years of age or older.
Yeah, that's the one, right?
Yes.
You're over 18, you're 20.
Hello, my name is Melissa Parisi, and I'm excited to be participating in the World Down Syndrome Day activities sponsored by Down Syndrome International. I work for the National Institutes of Health, which is the United States National Research Agency, and I coordinate several of the research programs related to Down syndrome, as well as serving as the chief of the Intellectual and Developmental Disabilities branch at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. At the NIH, we have been supporting Down syndrome research for many decades, but in 2018, we launched an ambitious new research project known as INCLUDE. INCLUDE stands for Investigation of Co-occurring Conditions Across the Lifespan to Understand Down Syndrome, and we are making sure that people with Down syndrome are included at every step of the process. This project has galvanized Down syndrome research by investing over $180 million in over 200 new projects since 2018. We are doing this in 3 different ways. The first way is by focusing on basic science studies to understand the biology of Down syndrome. The second way is by building a large cohort of individuals with Down syndrome across the lifespan to better understand their health issues. And the third way is by including people with Down syndrome in clinical trials to help improve their quality of life. Many of these projects are also international in scope. We also bring families into the research activities by engaging with the Down Syndrome Consortium, which is a partnership involving many national and international research and Down syndrome advocacy organizations, as well as self-advocates and NIH representatives. And we are using the DS Connect registry, which you will hear about in just a moment, to help recruit for the cohort studies. Finally, NIH is creating an inclusive and accessible public data resource that is launching today, March 21st, to empower collaboration and data sharing within the global Down syndrome community. To me, inclusion means allowing everyone who wants to participate in a research study to do so. So please join me and become a part of Include. Thank you.
Hi, my name is Emily Chestnut, and this is...
My name is Noah.
And you are how old?
11.
11. I've always been excited to join groups and network and get to know others, but before Nora, I didn't really feel like I had a cause that inspired my advocacy. Since she was born, I've jumped in to join with as many families and networks to advocate for both Down syndrome and other developmental disabilities. I'm also a scientist at heart. My undergraduate degree is chemistry. One road of advocacy I've taken is through research, learning about and participating in research. Through one of these such meetings, I was connected with the DS Connect and now serve as a parent representative on the research review team to help vet research projects that are shared throughout the DS Connect. It's so incredible to hear from such a wide and growing range of scientists whose research topics will help improve the lives and futures of Nora and her peers for many years to come. For all of my friends and family who are looking for a simple way to help this community, DS Connect offers a fantastic tool that will help advance science and treatment, both by sharing health information about our loved ones directly in the registry and by connecting to research scientists who are conducting the research. Nora participates regularly in cognitive research that's led out of Cincinnati Children's Hospital. Not only does Nora love her doctors and her research team, we get reports from that research that help inform her educational experiences and services at school. To us, inclusion means a long and fulfilled life. Yes?
Hello, I am Sujata Bardhan, and I'm thrilled to be part of World Down Syndrome Day, sponsored by Down Syndrome International. I work for the National Institutes of Health and manage grants that are focused on Down syndrome across the lifespan. I'm also passionate about increasing diversity in all levels of our involvement in the Down syndrome community, be it the researchers and the trainees that we fund or the participants that take part in research. To achieve this goal, NIH created and sponsors the Down syndrome registry called DS Connect, which was launched back in 2013 and was the first national registry for individuals with Down syndrome. Currently, I serve as the coordinator of this registry. The DS Connect registry is a powerful online resource where people with Down syndrome and their families can take confidential health-related surveys. They can connect with researchers and healthcare providers and choose to participate in clinical studies on Down syndrome. This resource is also available in Spanish. Currently, there are more than 5,000 participants in the registry, and we have been able to support more than 85 studies to recruit and meet their goal. We hope to increase the number of participants in DS Connect as well as increase the diversity in the participants. We hope that with our sincere efforts, we will be able to improve the lives of people with Down syndrome and their families. For me, inclusion means for everyone to be able to take part in this exciting journey. Get DS connected today. Thank you.
Think there's somebody that we should thank?
Yes.
Can you say thank you?
Thank you.
DS
DS
Connect.
Connect.
The more we know and shared, the better. I am DS Connected. Are you?
Thank you for sharing, Melissa.
You all shared so much interesting, informative, exciting information. And I hope that lots of people on this call will be interested in participating in the research that you're doing and participate in the registry. We have some time left. Is it okay if we open it up for questions?
Absolutely.
So people, you can either, turn your cameras on and, raise your little virtual hand. to ask a question, or you can put it in the chat box, but I'm sure lots of people have questions. We'd love to hear what they are. Oh, and Linda just shared the YouTube video. So thank you. And I did share the evaluation form in the chat box, but I'd really like to use this time now to answer questions that people might have. Well, I might not have any questions. You guys did such a good job. How could
Maybe we can. Oh, go ahead.
I was just going to say, how could we at the Down Syndrome Network help you to promote that, right? Like we can put this on our listserv, we could put it in our newsletter, on our Facebook page, you know, because I'm sure there's a lot of people who aren't here tonight that don't know about this. So as an organization, we can certainly make a pledge to support you by doing that. We have a good question from our board member, Heidi DePaula. Is there any research being done on Down syndrome, dual diagnosis of autism and Down syndrome?
Yes, absolutely. So that's actually a very important topic, and one that there are a couple of avenues of research. The Down Syndrome Medical Interest Group, which is one of the organizations that is a part of the Down Syndrome Consortium and is made up of healthcare providers who have an interest and a focus on working with individuals and families with Down syndrome. They actually have a specific working group on Down syndrome and autism, and they're trying to develop some standards of care, some standard ways of making the diagnosis, because sometimes it can be a little bit challenging to make a diagnosis using standard autism tools. And a number of those medical providers and investigators are certainly working towards include funding. And I know that I suspect that pretty soon we will have some projects that are specifically looking at Down syndrome and autism. I know it's sort of one of those co-occurring conditions that can be very challenging for families to manage. And one of the projects that we are funding right now is actually trying to ensure that we have good measures to actually understand whether children, or usually children, but sometimes adults with Down syndrome who may have conditions such as autism, to be able to measure that and be able to determine whether or not they're responding to treatment interventions. So stay tuned for more in the space, but it's definitely an area of research priority.
And Melissa, I would like to add that, you know, one thing that we are also trying to do through the Include initiative is trying to bring investigators who are specifically not working in the Down syndrome field, but probably are working in the co-occurring conditions, and then supporting them to, you know, really think about if they can add in their studies individuals with Down syndrome as well. So that is something we hope to do with Include, is to, again, that would increase the pathway for investigators, but also bring in investigators who are not in Down syndrome, but focused on other areas as part of the Down syndrome ecosystem.
Absolutely.
So we
Yes.
have some questions having to do with Down syndrome and mental health.
Yeah, we are funding. In fact, it's probably even on the DS Connect. We are funding a trainee who is looking into mental health, specifically related to, you know, the COVID-19 closures and how that has affected the mental health of individuals and also caregivers. You know, it has been hard on individuals and families because, you know, the services, the social aspect of, you know, their daily life has been upended. So, you know, it's still recruiting. So I think, you know, that's what we also have been able to do, is really support trainees during this pandemic, you know, who were able to add some interesting studies to their already existing study.
And I would add as well that, one of the co-occurring conditions for some children with Down syndrome is ADHD, or attention deficit hyperactivity disorder. And right now we are funding a study that's trying to look at some medications that are being used to treat ADHD in children with Down syndrome to see whether or not they're going to be effective for children with Down syndrome as well. So that's an important area of research. One other thing that may relate to mental health too is in looking at adults with Down syndrome and trying to determine what types of factors might either increase risk or reduce risk for developing Alzheimer's disease as those adults age. There are some studies that are looking at whether there are some, socialization, the social network for these adults with Down syndrome, whether exercise and diet and other types of sort of lifestyle factors might actually help mitigate some of those risks to develop Alzheimer's disease. So that's an important area of research as well.
And I just put in the chat the study that I was saying by Dr. Ruth Brown. So that's still recruiting. So if you're eligible, please check it out. If you have questions, reach out to the investigator. Again, she is Include funded, and we are also using DS Connect to recruit.
Someone had a comment about Down syndrome and dendrites, and I don't know specifically if there's a question related to that. Yeah, do you want to say more, Darlene? Go ahead. You seem to be muted. Or if we can't hear you, maybe you could put something in the chat.
Oh, her mic doesn't work.
Yeah. Feel free to put something in the chat if you have a more specific question. I guess we would also like to hear from you all in terms of, what are the ages of your loved ones with Down syndrome, and what kinds of questions or research topics do you think are important that Include should be covering?
So there is a question from Exegene. I'm not sure if I pronounced your name correctly. Her question, her or his, I'm not sure about the gender, sorry, is all DS had mental issues. So, there's a lot of variability with individuals with Down syndrome, very heterogeneous. And, there was a picture that Melissa posted of Mr. David Egan. He's a self-advocate. He has, he's also very accomplished, part of Special Olympics. And, Melissa and I had the fortune of being invited to his home when we were interviewing for a segment on DS Connect. And I have to say, when I walked into his room, which had 2 of the walls were full of medals, so inspirational. He's even written a book. So, I think for individuals with Down syndrome, there's a lot of variability. We cannot, generalize, and really with interventions and proper guidance and a lot of, treatments, hopefully everyone can live to their full potential. So I remember I took a picture and showed it to my kids, because just going into his room, and he was not even 40, I think he was 35. And what he had accomplished in just 35 years was amazing. So I think, it's hard to just generalize and put and define someone with their Down syndrome. That doesn't define a person.
So I see Darlene was able to ask her questions about research on how brain signals are transmitted to people with Down syndrome, and asking about dendrites. So, I think it's complicated. I mean, dendrites are the parts of nerve cells that receive the signals and the messages from other nerve cells or sometimes we call them neurons or interneurons or other supporting cells. And then signals between neurons get transmitted through a projection on those cells called axons. And right now there's a great deal of research that is actually trying to understand how these nerve signals are transmitted. And in particular, there are a couple of really important genes on chromosome 21 that are important in what we call myelination, which means the coating, the white matter, which is sort of coats the axons and is really important for the transmission of signals between neurons and between different portions of the nervous system. And so because there's an extra copy of these genes that are really important in that myelination process, there's some research that's actually trying to evaluate what is different about the transmission of signals in the brains of people with Down syndrome. And some of this research is looking at cell cultures and trying to create neurons in a dish that show some complex interactions. And some of the research being done at this very basic level is also looking at animal models that have extra genetic material that's comparable to human chromosome 21 and trying to see how their nerve signals are transmitted and how the myelination patterns may be different as well. So there's a lot that we're learning about this. It's complicated, of course, because we don't really understand how the brain works even in people who don't have Down syndrome. So there's a lot more to learn, but there's certainly a lot of progress being made as well. And there are some targeted therapies that have been undergoing clinical trials recently. Unfortunately, the trial was stopped, but a medication that was targeting particular types of signaling molecules in the brain to try to help learning and cognition in Down syndrome. So stay tuned for more information about that. I don't know if okay, Darlene gave me a thumbs up, so I guess I came close enough.
Thank you.
Certainly. I understand there might be a question about the studies looking at the COVID vaccine in Down syndrome and whether the 4th dose of vaccine may be beneficial. So that was just approved like today. So this is hot off the press. I don't think, we know exactly how the details of how people with Down syndrome respond to vaccines, but we do have some research that is looking specifically at the immune system, which is really important for helping us to develop immunity to COVID-19. And we know that because of, again, having that extra copy of chromosome 21, there are excess of something that we call interferon receptor genes. And what we think this means is that the immune system for people with Down syndrome is kind of always in a little bit of overdrive. It's kind of hyper-regulated. And we think that that may actually mean that some individuals with Down syndrome may be a little more susceptible to the side effects of COVID-19. There was a large study that was done across the world trying to figure out what kind of risks were impacting people with Down syndrome. And it turns out that especially in the early days of the pandemic, in particular when older people were more susceptible to COVID-19, it was also found that about 20 years younger than those more elderly individuals, at least in the Down syndrome population, were also a little more susceptible. But I think the data are showing that Down syndrome individuals can be effectively immunized with the vaccine. I don't know specifically about the 4th dose, but I think the vaccine has been shown to be really pretty safe in many individuals, including those with Down syndrome. And I certainly encourage everybody that I meet to get vaccinated to help protect yourselves and your family members, because I think this virus is going to be with us for quite a while, and we need to figure out ways to live with it and to be able to, if we do catch it, to be less susceptible to the more severe side effects.
Yes, and I put in the chat the survey conducted by Trisomy 21 Research Society. It was conducted globally, and I've just put it in the chat. So yes, it did, at least from the survey, it did not show that individuals with Down syndrome had adverse effects of the vaccine. And if you can look at the data, there was of course, participation from the United States, but also all over the world. the countries are also listed.
Thank you.
And I think the 4th dose, if I know, just has been published for older adults today or yesterday, or people with immunocompromised issues. So I don't think it has been, it's for everyone right now.
But I think, yeah, go ahead, Joy.
Oh, no, I was going to say, I think it was 50 and older.
50 and older, yeah.
Right.
Yeah.
But I know that the Down syndrome population, according to CDC, has been considered a high-risk population. So I haven't had a chance to look at the CDC's webpage about COVID-19 and whether individuals with Down syndrome might be also considered in that higher risk population as well. I think that's worth looking into, and maybe someone's Googling it now as we speak.
Would anybody else like to turn their camera on and ask a question or add another question in the chat?
Or let us know what kind of research you think we should be doing. What do you think are some of the unanswered questions? Someone's raised their hand.
Yeah, Marie has her hand up. Marie Hunter.
Hi, everyone. It's Mare, actually.
Oh, Mare. Hi. Sorry.
No problem. It's a normal mistake. So I have kind of an interesting question. Well, it's not interesting. It's interesting to me, but it's so my daughter doesn't have any things going on that I think are in some of these really specific Down syndrome studies that are going on. And I've been wondering if she can be included in, or if hypothetically she could be included in any control groups, just for kind of more general things. Can she be included in studies that might be for more of the general population? And of course, I'm thinking about things like in terms of Alzheimer's or, some of these things that we're hearing about right now. It seems like a lot of the things, not that I'm signing her up for every study, but the things I read about, it looks like a lot of people with Down syndrome are kind of automatically disqualified for just kind of having different, a different baseline than other folks. But knowing that, I'm interested to know why, I guess that there there can't just be a subset in some of these studies, or sorry if I'm not being super clear. I've been curious about it. Okay.
This is a very good question, Melissa. We have definitely an NIH have been thoughtful about this issue. Melissa, do you want to give some background of our previous council member who raised this question, and then how we are tackling it?
Well, yeah, I mean, this is a really interesting story, and if you all will indulge us for just a moment. So some of you may have heard of Tim Shriver, who is the son of Eunice Kennedy Shriver. He's actually a Montgomery County resident as well, and he's the CEO, president of the Special Olympics International. He was also on our council, which is an advisory body that oversees what we do at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. And at one point, we were learning about something called the ABCD study, which is really looking at adolescent brain development, adolescent brain and cognition and development study, which was enrolling 9 to 11-year-olds to try to understand how the teenage brain develops. I know it's a scary concept, but it's something that is really, doesn't deserve some attention. And also understand how social factors, substance abuse, and other activities in fact impact the development of the adolescent brain. And Dr. Shriver, he spoke up and he said, you're excluding people with intellectual disabilities in these studies, and there's really no reason to do that. And I think his speaking up and saying that really caused a lot of people to rethink how we think about research and inclusion, and to really have a reset with regard to, there are a lot of studies that are undertaken, and it's just kind of a knee-jerk reaction to say, well, we'll exclude anyone who has an intellectual disability or has an IQ under whatever sort of cutoff. And really, perhaps that's not a good criterion, because we have a lot to learn from people with intellectual disabilities. We have a lot to learn from children and adults with Down syndrome. And in fact, if we include them and figure out ways in which we can be inclusive, I think the research is going to be richer and it's going to help us learn more. So we really believe that inclusion is an important priority. And in fact, there are some studies in which people with Down syndrome are considered the controls in comparison to other groups that maybe have Fragile X syndrome or some other genetic condition. And then there are some studies that are comparing people with Down syndrome who have leukemia with those who don't have leukemia, or comparing children with Down syndrome who are born with a heart defect versus those that aren't born with a heart defect. So I think that there are a lot of ways in which individuals with Down syndrome can participate in studies whether or not they have the particular condition that's being compared.
Yeah, and one of the studies that we are also funding, and you've heard Dr. Esbenson's name a couple of times. She's the chair of our research review committee. And, and part of her study looking into the safety and efficacy of a stimulant medication in children with Down syndrome and ADHD. And as part of her clinical trial, she's also looking at children with Down syndrome without ADHD. And one of the ways we are helping that study is recruiting through DS Connect. So I would again encourage families to be part of the registry, because now with so many researchers that we are able to fund in just 4 years, they are coming to DS Connect to recruit, not just for their clinical studies, but also looking for controls. And the other thing is that for us to even know the landscape of, what is the baseline health history of individuals with Down syndrome, I think the registry would be a great tool for that. I think there was, one data that we had looked into is, we all know from literature that 50% of kids with Down syndrome are born with congenital heart defect. But I think a follow-up question in the registry was how many of them actually needed corrective heart surgery. And the percentage that did not need was, I forget, it was probably 80 or 90%, Melissa. I don't remember the data, but it was really surprising. So even that kind of data that, yes, they're born with 50% congenital heart defect, but not everyone is having an open heart surgery. So for us as funders and for researchers to even see that kind of baseline health history to understand, the natural history of Down syndrome is missing. So I think that's where families, can really participate, even if you're never eligible for a clinical trial or you do not want to participate in clinical trial. That's really up to the family's choice, but really giving that kind of baseline information is also useful for us as a funding agency and for researchers who are also looking at this kind of data.
And I would point out too that there are some conditions that people with Down syndrome are less likely to get than the general population. And, Sujata was just talking about surgery for congenital heart disease. And it turns out that one of the more common types of heart disease that is corrected with surgery is something called an atrioventricular septal defect, or AV canal. And it turns out that babies with Down syndrome tend to have better outcomes than babies without Down syndrome who have that particular type of heart difference. So in fact, the children with Down syndrome do better. When it comes to adults, it turns out that certain types of cancers and solid tumors are actually much less common in the Down syndrome population. Most adult women with Down syndrome do not have a very high risk of developing breast cancer or prostate cancer in males. So in fact, they're protected against certain types of cancers, which is really something that we hope that we can learn from, because we think that that's telling us something about the protective effects of trisomy 21.
Yeah, and maybe this, I was thinking about the presentation, maybe after the co-occurring condition, we should have a slide of protective factors of Down syndrome. That would be really a good picture of also the research that we are funding, not just in the what's going wrong, but also like, the protective factors as well.
So I see Darlene put another question in the chat about the connection between Down syndrome and celiac disease. And, yes, as a matter of fact, so when I was talking about the immune system in Down syndrome, and we think about our immune system as being really important for fighting infections, like viral infections like COVID or bacterial infections. And it turns out that the autoimmune conditions such as celiac disease are also more common in Down syndrome. In part, we think because of this kind of hyperactive immune system. It's like revved up and ready to go, even when maybe it shouldn't be revved up and ready to go. And we think that tendency of the immune system to sort of attack some of the cells in the intestinal tract that allow you to process gluten is abnormal in many people with Down syndrome. And as a consequence, that's partly the thinking behind why celiac disease is more common in Down syndrome. And we have a number of investigators who are studying immune system and immune system dysregulation in Down syndrome that we hope will shed some light on some of these phenomena.
And I will put in the chat something that we are also a funding opportunity announcement. So if you know researchers that would be interested, please share it. It's really advancing research in GI dysfunction in people with neurodevelopmental disorders, including Down syndrome. So I'll just put that link here.
Thank you. Well, this has been such a wonderful presentation. You guys were all wonderful women, not guys. We're all wonderful presenters and shared so much valuable information. We're so grateful that you gave up your evening to be with us. I'm assuming we don't have any more questions because nobody else has put any in the chat box.
The chat's disabled, just FYI, on my end anyway. Yeah.
Really? Okay. It's not disabled on my end, but so last chance, if anybody would like to ask a question, turn your camera on. And Mayor, did you get to ask everything that you wanted since the chat is disabled for you?
No, everything I've heard tonight, absolutely. But for part 2, I'm going to have a lot more.
Well, you also have our email addresses. If you have questions that you didn't get answered, please feel free to reach out to us.
All right. Well, I guess we will draw this meeting to a close then if there are no more questions. So thank you, everybody who attended. And thank you to Dr. Parisi and Dr. Barthan and Linda for being here and sharing your information. And at the Down Syndrome Network, we will continue to, we will promote what you're doing to make sure that our members who aren't here tonight know, and hopefully you'll get greater participation.
Thank you.
Thank you so much.
Sure. All right.
Thank you. Good night.
Bye, everybody. Good night.